This is the conditioning regimen pre-transplant that is more than a decade in making. So the idea here simply was to design a myeloablative conditioning regimen and to it add all the agents that are active in AML and to see if we could reduce the relapse rate. So the trick here was to do it safely. So the first thing we did was, instead of giving it over a 4-day period, we gave it over a 3-week period. So we start on day -20, give a dose of Busulfan, and continue Venetoclax along with it, and then come in later with Cladribine, Fludarabine, Thiotepa, and rest of the Busulfan. So what we found is that if you do it this way, you can give a very aggressive regimen very safely. So our idea here was, in this particular trial, was to test it in the patients who are at the highest risk of relapse. So patients were eligible if they had relapsed or refractory disease, and if they were in remission, they had to be having MRD positive or ELN adverse risk AML. And we allowed for any donor, including haploidentical and mismatched unrelated donor, and about a quarter of the patients had those. Our age limit was up to 70 years of age, and the median age was 75. Because this was a high-risk population, we had almost a quarter of the patients with TP53 mutation. 75% of the patients were MRD positive, and a third of the patients had active leukemia, and 2/3 of the patients had ELN adverse risk disease. Next, what we observed was the primary endpoint here was progression-free survival at 1 year, and our goal was to beat the historic progression-free survival of 30% in this population of patients. And what we found was 3-year progression-free survival was 58%, with a relapse rate of 24% and non-relapse mortality of 15%. So we were very encouraged. The study met its primary endpoint, and we now have a regimen which is myeloablative, which combines all the agents that are active in AML. And we are now going to carry it through to a phase 3 study. What was very exciting about this was, in TP53 negative patients, despite the high-risk disease, 3-year survival was 74% with a relapse rate of just 13%. So we are very excited, and we'll see what we see in phase 3 study.